Welcome to my podcast. Today I'm going to talk about another common case that you can face in the clinical setting or in the GB surgery. So basically, after you introduce yourself and double check the patient name and date of birth, the patient will say, "Doctor, I'm having this bad skin condition, usually in the winter time or in the cold weather, and it's really dry. And I don't know what should I do about it. So I tried everything that I can buy from the pharmacy or from the shop, and it's not working." So you'll tell the patient, "Can you tell me more about it?" So the patient might say that, "I'm having this dry, flaky skin. It's itchy, it cracks, and I can't relate it. So can you help me?" So basically, you need to explore about the causes and the risk factor. Say, for instance, we know that a very dry air could predispose to dry skin, cold weather as well, because the skin will lose basically the water from the skin surface, so the skin will feel dry. Hot showers, if you take a prolonged hot shower, usually this will dry the skin, and using a harsh soap or detergent like in the era of the pandemic, that will cause irritant and dryness to the skin, and the skin will be dry, will be flaky. And also, if the patient is exposing too much in the sun or go to the beach and lie in the sun without using a moisturizer, this will predispose as well. So it's basically a temporary condition that can be dealt with. However, it can be a lifelong issue in certain situations like eczema, atopic dermatitis, psoriasis, whereby they need specific prescription and specific creams. However, what you need to tell the patient, of course, after you are inquiring about the past medical history, medication-wise, if there is a family history with the same thing, what sort of job do they do, what's their lifestyle like, and then you will advise basically about the whole concept in order for the patient to understand and use it as a daily routine in their life. So you'll tell them you need to use a moisturizer. The idea of the moisturizer is to seal the skin and stop the water from escaping and evaporating from the surface. And you have to apply this basically several times a day, which will seal the skin and keep the moisturizer. Also, there is some thick moisturizer brands which used basically in dermatology, like Cetaphil and Eucerin, which also can be found in certain shops here in the UK, like Superdrug, Boots. They work really good, and they give the moisturizer needed for the skin. If the skin, for instance, is extremely dry, you will advise about oil-based moisturizer. So basically, there are certain creams which have the oil element, or maybe you can just advise about the simple thing like olive oil or baby oil. While the skin is it's moist, the patient can apply that to the skin, or even in certain places they sell, basically some oils with a dropper, so you can apply it after taking the bath, after your bathing, and this will keep the water from evaporating from the skin and will keep the skin soft and supple. Also, there is another modality can be given as well. It's usually basically mostly in the psoriasis. It's mostly ointment based, which is means that the fat element is more. So it's like petrolatum jelly, white petrolatum jelly as well, or Vaseline, or are helpful. However, they can be crazy and the patient might not like it. The other thing you'll tell the patient, you need to ask them to apply the moisturizer usually after the bathing immediately. So tell them to bath your skin with a towel and then apply the moisturizer. Ask them how long they stay in the shower. So if they stay for instance, for quite a long time, ask them to minimize it, like few minutes, can't be more, because long showers and baths with hot water All of that will remove the oil from the skin, and this will predispose to dryness of the skin, which can be irritant and annoying and frustrating to the patient. The other thing, you need to employ that to avoid harsh drying soaps, and just use the one with the oil and the fat, because there is a different regimen of those kind of things in the shops. Also, another thing you can tell the patient to use, especially in the UK, the humidity and the housing with the winter time. It can be very humid, and this will cause dumps. So tell them that they can use a small portable humidifier, which basically will help because the dry indoor air can ignite and irritant, cause irritation to the skin, itchy and flakiness. So try to keep the humidifier clean, try to use it frequently, and if there is water, you need to remove it, and this will help with the indoor air. Also, ask the patient what sort of fabric do they wear. I remember back home when I was working, so I used to tell them my patient to use always cotton, which close to the skin. Also, silk can be used, and anything that has cotton. However, avoid anything with polyester or wool, because all of that will irritate the skin, will cause it itchiness, flakiness, and dryness as well. So basically, you just need to explain simple measures which can help and make a lot difference to the patient life. And this can be considered as a lifestyle measures which can help dramatically and improve the situation. I also remember that my patients, especially the psoriasis, I always tell them that you need to keep the white petrolatum and Vaseline always in hand, and always use it frequently, which will help with causing sorry, the scales to be moisturizer and improve it. I hope by that I just briefed you about dry skin and how to help the patient to come on top of this issue and improve it with time. Thank you.